If health is wealth, then AI is helping us get richer. From improving clinical care to empowering personal health monitoring, AI-driven solutions are taking part in changing the way we get and stay healthy. AI has found itself into different aspects of health and wellness. From molecular diagnostics and genetics to radiology and orthopedics and even mental wellness, AI is revolutionizing healthcare services in ways we can never imagine. AI's role in the Philippine healthcare system continues to grow, as medical services are pushed to be better and more accessible to the Filipino public.
Thank you for the opportunity to share our work. I'm used to giving disclosures. My most important disclosure is I have no financial disclosure yet. We have not sold any of these projects that we've made. And also, I'd like to acknowledge that these are projects of multiple teams from different departments, both of the College of Engineering and the College of Medicine of UP. And I will show their names later per project, so please watch out for them. And lastly, these projects were funded generously by the Department of Science and Technology and also by the Philippine General Hospital, whether partly or in full. So another thing that we do when we present is usually start with a case. And I'll start with that because I'm more comfortable speaking like that. So this is a 78-year-old male who was complaining of not being able to do the activities of daily living comfortably because of hand pain and deformity. Pasensya na po. It's my specialty, so I'll focus on that. So seen by a primary care, if it exists in their place, sana, no? But they were told that they need to be seen by a specialist. And you can just imagine someone from the province who have to travel 40, 50 kilometers just to see a specialist. And then when they get to the clinic, because the specialist, so many patients will be told, oh, do these exercises, and then see me again next week, so I'll see if you're doing the exercises properly. So the patient will probably never come back. The patient will not be well of a condition that could have been managed with a different approach. So that's what we're trying to do now. So this is definitely a common problem, and I'll focus on my specialty. Don't know if this is still updated. We have a very low doctor-to-population ratio of 0.37 to 1,000. And we even did our own in our specialty 4 years ago. It was much lower. We only have 0.71 orthopedic specialists per 100,000 Filipinos. And most of them are concentrated in the metro. So you can just imagine the problem that our patients face when they are in the rural areas. The graph on the upper right actually shows how we fare compared to to other countries. Of course, the first world countries will be on the right, but we are still relatively low compared to our regional counterparts. And of course, with the ongoing brain drain, the problem is just getting worse. So during the pandemic, there were challenges that also became opportunities. With Doc Pros, we had a team that developed the bot called MyBot, ensuring safety and health in isolated environments, or MyBeshi. Very warm named bot. It's trademarked, so at least we got that. And then we realized that there is a lot that we can learn from telehealth. We can capitalize on technology to be able to bring specialists to areas where they may not need to be, or it's not practical for them to be physically present. So we started with the problem of isolation, and that was the main problem with COVID anyway. We saw it as an adjunct for remote evaluation and telemonitoring of patients. With that simple bot, we were able to at least demonstrate that it may improve efficiency and safety in providing care not only for the patients but also for our healthcare givers. Beyond the pandemic, and being in a country with many islands, we thought of such solutions, technology that may enhance telemedicine, which essentially will bring the specialists not only in isolated areas but also in remote localities, as I've shown the problem, where they may serve as where the technology may serve as force multiplier for clinicians, and even up to the point where patients may use these as personalized care, personalized motivator, such as gamification of such technology that they can use on their own to try to help them recover, similar to the concerns of our index patient. Now, talking about, again, my specialty, And I have to admit and announce that I was a frustrated engineer. I was actually enrolled in Triple E before I was dragged by UP Manila to the the light side. I may get in trouble for saying that this is the dark side. But orthopedics in general, we are easy to convince when it comes to technology. We are early adapters. It's like preaching to the choir. We have our hands up even before we announce what technology is actually available. So we're the specialty that has been doing robotic surgery, has been using AR and VR. And of course, AI is on the horizon. Although locally, we're really just beginning. What we focused on, this was during the pandemic and even after the pandemic, is human motion capture. So what is it? We know, and we may have seen this when they use it for visual effects, for cinemas, and they have been used a lot for sports performance evaluation, but they do have uses when it comes to health and wellness. We can observe range of motion, measure range of motion, and trends and changes in the range of motion for us to be able to, one, diagnose conditions, and also monitor if the patients are changing over time with the treatment that we have provided. We're lucky to have the first, and I think it's still the only gait lab in the country, in the UP College of Medicine within PGH. And it's good that it's available, but unfortunately, it's still very expensive. And it needs a lot of equipment for it to be useful. So that's why we thought of alternatives. And this was made possible, like I mentioned, with a collaborative work from 2 colleges across Pasig River and different departments within each college. So this became the start of many partnerships, and I'll go through some of the projects that we were able to accomplish. So we start with one. The first use is as simple as measuring range of motion. Measurement of range of motion is usually done, aside from, we call it just observing, or it looks full or it's not that full. The objective way of doing it is actually measuring it with a goniometer. That gives us numeric values. It's good, but unfortunately, there may be variations even among experts. And it also does not necessarily represent how the bones are moving, because if you have a relatively thick skin or fat in between bone and skin, there may be errors. And so we're always looking for ways to try to make our detection more accurate and, of course, more efficient. And that's where the idea of marker-less detection, as compared to putting them in a gait lab or in a motion lab where they will need markers. This may definitely aid in the diagnosis and monitoring of conditions. So one of the projects that we did not only looked at comparing the goniometer with a computer algorithm, we also looked at X-rays to make it as close to accurate measurement as possible. And we're very happy that we found it's not perfect, there are still technical issues, but we found good correlation between those measurements. This was also supported by another project where we tried to look at the bigger joints. So aside from just looking at the hands, measuring the different movements of the fingers of the hands, both in 3D and 2D. We also looked at other joints that are difficult to measure, like the shoulder, and we were able to use this in a patient who's recovering from stroke. So it's effective both for large and small joints, and we can see this being used in a variety of conditions, whether it's something neurologic, something infectious, degenerative, or neuromuscular movement disorders, and even with different types of management that we can offer our patients, whether it's conservative observation, physiotherapy, or even surgery. We also made another project, and this was with a group that's also with Prof. Pros, that looks at fall detection. So why look at fall detection? Fall, as shown here, is still an important source of mortality and morbidity among our population, especially in the older population. As our populations are getting older across the globe, we know that this can be a problem. During COVID lockdowns, we know that there were patients who were not observed, that they were falling and having accidents because they were not allowed to have companions close to them. And so a simple program that can monitor their activities, whether they're standing, sitting, will help support them when they're in their everyday life. And at the same time, fall detection will be able to detect emergencies and will be able to send help. So our algorithms, our framework outperformed previous work. This is very promising, and we're continuing the work in our clinical setting at the moment. And another important thing that we're able to do was to make it run efficiently even with low-end devices, because even if we have the best algorithms, if we need expensive equipment for them to work, it will not be very practical. The last example, which was done with Triple E, is in the surgical suite. So, of course, our treatment starts from the clinic, and sometimes we have to go to the operating room. So we're not yet, not locally at least, applying AI to aid us directly during the procedure, but this is to aid us as we try to look at the images, our MRIs, our CT scans, when we are doing surgery. Dr. Joey emphasized the importance of being very familiar with what you are trying to take out or trying to cure inside the body through imaging, and it's the same for us during surgery. Usually, if you see the two small pictures, we can either remove our gloves or our gown and try to manipulate the image and then go back and do it several times so that we're able to see exactly where we want to be for every procedure. Or we can ask someone who may be knowledgeable, and it can be a struggle. It may take you 30 minutes to get someone to get to a point where you want them to be. And so what we did was essentially control the images with a simple camera and try to do hands-free manipulation of the images on a computer screen without scrubbing out. So that conserves our PPEs. At the same time, it increases the efficiency of how we do our procedures. And this is very important for delicate procedures. So based on our initial testing of 17 OR personnel, they were very happy with it. They're willing to use it, but of course with some glitches that we need to fix. And so in all of these projects, we realize that there are challenges, but we also have to catch up with technology. Doc Pros keeps reminding us that this is a fast, evolving technology. If we don't publish, if we don't come up with products as soon as possible, we'll be left behind. So that's our goal. And there are technical aspects of it that we're improving on. Each project still moving forward as planned, and we're also trying to combine all of these projects in one program. And that is with the help of our, again, generous donors. For each of the projects, one, we have an industry partners interested in the OR, in the hand gesture for operating room use. We already started testing in the clinical setting for the fall detection. We just received, just last week, the PGH grant for 2.7 million pesos to gamify our hand pose algorithm. And lastly, we're also getting, hopefully, it will push through in 2026, a big enough budget to get all of this into a program that will allow us to detect and measure movements of the joints across the musculoskeletal system. So in summary, I don't have to say that this has a lot of potential. Again, this is the choir I'm preaching to. But for us, really, aside from emphasizing the role of interdisciplinary collaboration in trying to get these innovations to run, our dream, our real dream, is for all Filipino to have access to technology that will be used and will be helpful to them, so they get better, even if they don't have to see the specialist all the time. So yun lang po. I'm happy to collaborate if you have topics in mind. Salamat po.